Now, welcome to the programme. A little bit of a gremlin in the system there. A digital error, as they say. We hope you are keeping well. Thank you, Ollie and Mary, for another marvellous show. We have the two Waterford-based papers out this morning, Waterford News and Star and the Munster Express. Well done to everybody involved in producing papers this week. Fair play to you, and the Dungarvan Leader, Dungarvan Observer out later and tomorrow. So please support local journalism. We're going to be talking to Seamus Dooley of the National Union of Journalists about the importance of journalism in a little while. We're also going to be talking to a man who's actually produced a book in the last 3 weeks regarding the coronavirus, coping with coronavirus. The men's sheds people are going to be talking to us from different parts of the county, and we have an exclusive interview with the US Ambassador, the Irish Ambassador to the United States, Dan Mulhall. We're also going to be talking to those that are over the age of 70. We want to hear from you about your stories, how you're coping. And Jennifer Kavanagh is going to be talking to us about the Shannon elections. In a minute, we're going to be talking regarding nursing homes and this idea that there are some nursing homes that are in clusters. Good morning, Damien. The first text in, 083 3333 975. I'm a bit confused here. Just wondering, why are people from the town allowed to go on long runs out the country? Why do they not stay in their own area? Yet I'm only allowed to walk 2 kilometres from my house. That's from a Kilgobnet listener. Well, my understanding is, from what the regulations are, they're not supposed to be driving anywhere beyond the 2 kilometre distance themselves unless they have a specific reason to go there. So anybody want to text us in about that, please do. And tomorrow we're going to be doing a special piece about health and beauty at home. So we're going to have some health and beauty experts talking about hairdos, talking about nails and all those things that concern men in particular. Firstly, a lot of people have been on regarding Bausch and Lomb over the last few days and also the last week. And the company are not making an official statement, but they did issue a letter to all the employees in the last 24 hours. And this letter basically sets out that the company will be staying open, that the company is going to be continuing production. It's an open letter to all the staff to thank them for the commitment and to the matters that they are doing. It says, while our work is related to important healthcare, we've been designated an approved essential business. I'm keenly aware some of you are concerned about your well-being. The letter is signed from Mark Hennessy, who is site lead. Want to say well done to everybody in Bausch and Lomb. I know it's very difficult times for a lot of people working in factories in particular, and they talk about social distancing, so management and staff. So what they've done is they've addressed the increased social distancing to the greatest possible extent. They now plan to further strengthen this by introducing a 15-minute gap between shifts to ensure no physical crossover. There's going to be no loss of pay for any time lost, and new working arrangements will continue until Friday, May the 1st, and then they're going to be reviewed. And they've decided to offer people, this is I suppose the big thing that Bausch and Lomb are doing, around 1,400 employees, the largest single private sector employer in Waterford City and County, I think the biggest in the southeast. They're going to offer the option of taking time for time, TFT, over the next 4 weeks, beginning on Saturday, April the 4th and continuing until Friday, May the 1st. So this basically is that if you're worried about your health, if you're worried about matters, you can take time off, but you owe the company time effectively. You'll still get paid, but let's say you decide to take a week off, you'll still get paid, but you owe the company that week another time later in the year, within the working year. So that's called time for time. And Mark Hennessy wants to take the opportunity to take the time out to tell every employee that they're going to make every effort to facilitate those who need to take time off, but they also can't guarantee all requests immediately. Do everything possible to ensure that all employees seeking to avail this offer are treated as fairly as possible. And they again advise everybody to use an abundance of caution. Protect yourself and your family. Continue to follow all the advice around social distancing and hand hygiene. And finally, he says, let me say that I and my team remain deeply appreciative of your continued commitment to supporting our customers and patients as we navigate this very worrying and fast-changing landscape. That's from Mark Hennessy, site lead at Bausch and Lomb. So anybody wants to get in touch regarding how their own factories are working, please do. 083 33 975. You can call Audrey on 051 846 123. I've got Tig Daly on the line. Good morning, Tig.
Good morning, Damien.
Thank you very much for joining us.
You're welcome indeed.
I know you're a very, very busy man today, and particularly over the last 2 weeks and the last 48 hours in particular in terms of dealing with government at high level, and I appreciate you giving us your time this morning. You're CEO of Nursing Homes Ireland. We've heard that there are 17 clusters, possibly 22 clusters of coronavirus in nursing homes. You've met the Minister for Health yesterday to discuss the concerns. How did that meeting go?
Yeah, look, I suppose it was a positive engagement, and I think, to be fair, the Minister understood many of our concerns, because we were very concerned ourselves at what we would have seen over the last number of weeks, I suppose, is the lack of priority given to the nursing home sector. On the 6th of March, we would have made a decision ourselves to restrict visitors in nursing homes because we were very conscious of the exposure to residents and obviously the complexity of care of residents. So we got a good hearing, I must say, to be fair. And we are, I think it's important to say, working very closely with the department and indeed the HSE across the country. But I suppose the outcome of yesterday's meeting for me really was the comment by the Minister that we're all in this together. And I made the point to him very clearly that the on-call for Ireland, for example, it should be just that. It should be on-call for Ireland, not just on-call for the HSE, because the issues we're having are around equipment, around staffing and obviously funding.
Without revealing identities of particular nursing homes, have you been told, or are you aware, Tig, of the clusters and where there may be these very difficult situations in particular nursing homes?
Yeah, the only information we would have is what's in the public domain, Damien, because the Tony Holan and the NEFIT group every night, they announce those figures. And what I am aware of from the recent figures is that the majority of them are in the east of the country, and I think one in the northeast. So, and obviously we're dealing with members who have some challenges around that, but I suppose in the interest of residents and indeed staff in those facilities, we're abiding by, I suppose, government advice really that
yes.
Facilities shouldn't be named individually.
Yes, of course. And in a minute I'm going to be talking to Pádraig Dolan, owner of Havenwood Retirement Village. He's on the line in a minute. I'll come to you in a second, Pádraig. I'm going to let Tig go because I know he's busy. But Tig, a couple of more questions if you don't mind, please.
Yes.
What new specific measures are ye looking to put in place regarding, I suppose, stepping up procedures?
Yeah, well, I mean, to be fair, I think it's important to say that the sector has a strong record in terms of infection control. We would deal on an annual basis with challenges around winter flu and the vomiting bug, for example. Now, obviously, we're on a much different scale. So we are waiting for advices from Public Health, and I know the National Public Health Emergency was meeting at 10 o'clock this morning. The department will be back to us as soon as that's over in terms of their recommendations to government. So, in essence, we're waiting on what's coming from government. But I suppose what we would look for, and what we looked for yesterday, was a commitment around PPE in particular, because obviously if you have an outbreak in any particular home, we need to secure the safety of both residents and staff. The other issue for us is around staffing and ensuring that the prioritisation of healthcare workers. I mean, and I take this opportunity, people talk about heroes and heroines, and sometimes, they don't, I'm not saying they don't mean it, but sometimes maybe it's
yes.
misunderstood. But the people who work in the nursing home sector, I really take my hats off to them. I'm very proud to be associated with them, because the work that they're doing, leaving their own homes and their families to go in and look after the most vulnerable is very challenging. So we've asked for the prioritisation of both testing, but more importantly, or as importantly, is the results back. I mean, we've seen in the last couple of days where, some people have had tests back within 24 hours. That's not our experience, unfortunately. And to ensure that we can have both the number and quality of staff, we do need testing prioritised for healthcare workers.
Yeah, and
we were assured about that.
And just to explain to people again, what is a cluster when people talk about clusters?
Yeah, well, we did seek advices from Public Health on that, and as I understand it, it's more than two people in any particular facility.
Yes.
So when people talk about 22 nursing homes, I think it's important to put it into context as well, Damien, because there's 560 nursing homes across the country. So while 22 is one too many, as the old saying goes, what we need to do now is redouble our efforts to make sure we contain it in those. And the other thing I'd say to your listeners this morning, many who are concerned, I've no doubt, and we all share that concern, we all have family who we are concerned about ourselves, is that I'm aware in the last week and 10 days of residents who have been tested COVID positive and who have been nursed back through the commitment and the care of the nursing staff and the care staff in nursing homes to full health. So, just because you have COVID-19 doesn't mean that it's fatal. Obviously, it's more challenging for an older population. It is more difficult. There's no point in denying that. But I think we need to stay hopeful, stay focused on what we're doing in terms of staying at home, in terms of social distancing, in terms of coughing etiquette. And if we do all those things, hopefully we'll have brighter days ahead, and we'll be able to celebrate in the months to come the commitment of all society, not just nursing homes, of the wider health service and the wider community, about how we try to overcome this particular pandemic.
Yeah, I'll let you go now, Tig. I know some people that work in nursing homes, and you're 100% right there. The phenomenal work that's been done, and this is not it's not all the nursing homes, only a small percentage, as you say. One is one too many, but the work that they do is phenomenal. So very well said.
Absolutely.
Listen, Tig, it's lovely to talk to you. Mind yourself, okay?
Indeed, David. Thank you, and thank you to all your listeners as well, and stay safe, everybody.
Thank you very much. Tig Daly, CEO of Nursing Homes Ireland. I think now we have Pádraig Dolan on the line. Are you there, Pádraig?
Good morning, Damien. How are you doing?
Good, thank you. Thank you very much for coming on. You run the Havenwood Retirement Village. There's a nursing home there, sheltered housing in Ballygunner. How are you getting on, firstly?
We're getting on good, despite everything and all the bad news, I suppose, that's going around. We sat down about 6 weeks ago, I suppose, at this stage now, and said, okay, what can happen? And we've been working on contingency plans ever since then. Some good news, I suppose, is that the nursing homes in Waterford and South Kilkenny have really come together. We're talking to each other 3 times a week. We're being very supportive of each other with conference calls. And when we come up with a challenge, we've got 10 directors or nurses talking to each other and coming up with solutions. So, it's been very positive that way, that nursing homes are speaking together, are sharing ideas. It is very challenging. Definitely from the PPE point of view and from the testing point of view, it's very challenging. But again, all nursing homes, the teams that we actually have, the staff we actually have, they're outstanding people. Yeah,
and I really appreciate you coming on this morning, Pádraig, because it's important just to hear from somebody that's working at the coalface, as they say. When people talk about PPEs, that's personal protection equipment like masks and gloves. Do you have enough of those PPEs?
We do currently, again, I'm just talking about, on behalf of Havenwood, again, yes. 6 weeks ago, we looked at it, and I think we got ahead of some people, so we got a lot of stock in. But stock does go down very, very quickly when you have somebody in isolation. We worked out kind of roughly that we had 3 residents in isolation that were waiting for swabbing, and in the period of time it actually took to actually get the test results, we used over 2,500 masks.
So 2,500.
Wow. 2,500 masks. Yeah, again, that's just using the proper safety procedures in place, protecting our residents and protecting ourselves. Like, we had 3 people in isolation, but we also had another 7 people. 7 people in total in isolation because there were different contacts. Now, thankfully, we got the test results back there last Friday, and it was like almost Christmas when we actually got through, and they were all negative. It meant that isolation we could change the isolation and put back the PPE and back to normal. That's the frustration we would have had, is that the length of time it's taken to get testing done.
Yes.
Like if somebody goes into isolation, or if somebody, even a team member goes into isolation, we've got to go back and look at all the contacts they would have had with team members and also residents, and potentially those people would have to go into isolation as well. Pending testing or pending the 14 days. So it's a huge knock-on effect by actually having one suspected case, be it a staff member or be it a resident. So PPE to us has been manageable to date, but it can't be sustained. We really need the HSE to come up and help us, and that's starting to happen now slowly. We got a first delivery of PPE from the HSE yesterday, and I know that there's more planned from the shipments that are coming from China, but we haven't seen it yet. But it's promised to us, and I'm sure the HSE will step up to help us out.
Yeah, like even enough there to keep you going for, we'd say, another week, I presume, or longer, or have you worked it out?
Again, depends on the numbers.
Yes, of course.
Residents that go into it. It's like, I think roughly it's around 350 face masks, for instance, per person, if a resident goes into isolation for the 14 days. So if you have 64 residents, by the 350 masks, they're all in isolation, it's difficult.
Yeah, and we're going to be talking to Azuri later, because they're making the masks now. There's some great work being done. Another thing, Pádraig, I won't keep you too long, but another thing is this connection that your staff have with the residents is wonderful. And I presume last Friday when you got news, not only from their perspective, but as you say, from everybody's perspective, this idea that they don't have the virus. It just must have been, I'd say there was tears, was there?
Oh, there was tears. I actually, my office is downstairs. I could hear the shouting and whooping upstairs from the staff members. So I was going to say, what's going on? And when my director of nursing, Regina, rang me down and said, we're all negative. As I said, it was like Christmas. Now, we've since changed even further, enhanced our contacts. We've dared on Friday when the government announced that cocooning for over 65s and 70-year-olds, we've now gone to cocooning our residents as well. So our residents now are changed now from being in day rooms with social distancing in place now to being cocooned in their bedrooms. And again, the staff have got to deal with that element of it and deal with the allocations and deal with how that changes. Bearing in mind that we've been closed since the 6th of March, all nursing homes in Waterford were ahead of the HSE when it came to actually closing. So we closed our doors on the 6th of March, and geez, I hope I'm not jinxing it now, but none of the homes in Waterford have any suspected cases of COVID, which is fantastic.
It is
and
fantastic.
all the nursing homes now have gone to what we call cocooning now in the actual nursing homes.
Yeah.
Now that proves difficult for families. Look, we've our Facebook page has become a real go-to page for all our families to keep in contact. They're sending in fantastic videos, paintings, pictures, everything. We're trying to keep updates going on a daily basis, photographs. Again, this is just a call out to all people out there. Again, send us in anything you have just to brighten up the place. You can imagine now all our residents are actually in their bedrooms. We're trying to work on making sure they're exercised, making sure that they're socially, they're mentally, they're being treated properly, to make sure that they're engaged. Chris, our activity coordinator there yesterday, just suddenly has produced the Havenwood Daily newspaper. So a newspaper is going into our residents.
Wow.
It has all different activities they can do, has quizzes. It's all very suitable for our residents. And what we're going to plan to do is, put pictures of families, of poems, or anything we receive onto that newsletter. So again, there's plenty of contact points with our residents that they know what's going on outside.
Yeah, and for relatives to know, like if for relatives to know that is being done and that their loved ones are safe, that's the most important thing of all, isn't it?
Oh, hugely, absolutely hugely. You can imagine the anxiety that you have yourself at home, and you're able to get in and out of going to the shops and this kind of stuff. You can imagine the concern if you have somebody who is the vulnerable age profile, and hopefully we're doing the mining in all the nursing homes so well that we can continue that. I think there was one day last week where there was 10 deaths announced. 6 of them were actually people in nursing homes. So that's frightening when people know that.
Other parts of the country, yeah.
In other parts of the country, absolutely. As I say, we're very lucky here in Waterford and South Kilkenny that all the nursing homes came together very, very quickly and have shared the ideas, shared suggestions. We've all got contingency plans in place. We've all got PPE in place. We're telling each other where we can source PPE. There's a great sharing of information. And again, I'm proud to be part of the South East there, to be sure. That all the information is being shared.
And a lot of the residents, not just in Havenwood, but in other nursing homes and staff, will probably be listening to this morning. I want to say a special shout out to you all, and we're going to play a song at the end of the programme, especially for you, Pádraig, and also for your staff. I know you want to praise your staff for everything that's been done, every aspect of staff. Oh,
we have a super team here. There hasn't been a day in Havenwood since this started, and we're saying the 6th of March where it started for us. We haven't had a day where we hadn't had a full complement of staff in place. Now, we have to do an awful lot of swapping in and swapping out where we're isolating staff, but there hasn't been one day where we haven't got a full complement of staff, and I just think it's super. I think we got the superheroes are definitely around where they don't have to wear capes, as they say.
Beautifully put. Pádraig Dolan, to you and everybody there, mind yourselves and take care, okay?
Thanks, Damien. Thanks very much.
And well done. Fair play to you. Pádraig Dolan there, owner of Havenwood Retirement Village in Ballygunner. Really good news there, as you heard. No nursing home, we understand, in Waterford or the South Kilkenny area with any cases, and the work that's been done by everybody there is phenomenal. Some people texting in to say again, well done to everybody that is helping out with nursing homes, and also those relatives that have people in nursing homes. Well done for ye for sending in all the letters and all the pictures, and get your grandchildren to send in postcards and pictures and whatever the case may be. A couple of texts in, spare capacity of beds or new buildings in nursing homes, will those be used under a new public-private partnership? That's one of the things being discussed today, I understand. Another person texting about a different matter. Why is the bus still running between Tallow, Lismore, Cappoquin, Dungarvan? I don't know if it's still running. I presume social distancing is being agreed on within that area. A woman who works in a small grocery store in West Waterford has phoned into 051 846 123, appealing to people to stay at home. Yesterday they had people coming for a look around, buying maybe a bar of chocolate, but really didn't need to be there. And she says they weren't teenagers or children either. Another caller wants to congratulate guards and nurses and doctors and all those working on the front line for doing a wonderful job. She's a retired carer and says it's very difficult, but wants to say well done to them all. We had a lady text me in on WhatsApp. Hello, Damien. I have a sister in Bausch and Lomb. I'm very worried about her. They don't have very much social distancing in the locker room. As you heard from the letter that has been sent out this morning from Mark Hennessy in the last 24 hours, they're looking at that shift change being staggered now 15 minutes. And if anybody has any concerns that they're going to raise it with management, they can talk to management and work out a way of increasing and maintaining social distancing. Keep your texts and comments coming in 083 3333 975. Next, we're going to talk about the importance of local media. Now, in a second, I'm going to be talking to Seamus Dooley of the National Union of Journalists. As I say, I've mentioned the two local papers in Waterford this morning. Any newspaper that is coming out this week, today or tomorrow, please support local journalism. Before I forget it, happy 50th birthday to John Chalky White out in Passage East. Got tested on Saturday morning, says this other texter, waiting on results. Can I go to work? Please keep my name out of it. Another person texted about waiting nearly 9 days for results. Again, the regulations and the advice is if you are showing any symptoms whatsoever, you should stay at home if you have been tested and are waiting on those results. Seamus Dooley, good morning.
Good morning, Damien, and good morning to your listeners.
Seamus, thank you very much for talking to us. There has been a lot of, I suppose, interest in how the news is filtered out to people, and we talk about how RT's doing a great job, Virgin Media doing a great job, and all the national papers and national radio stations online, then so many different groups as well. The importance of local journalism and local newspapers, local radio. I know there was something given last week through the Broadcasting Fund, I suppose, regarding independent radio stations. Can you just outline to our listeners, please, how difficult a time it is for journalism in Ireland at present?
Well, I think it's a difficult time for all journalists, whether you're working in the national press, whether you're working in RTE, whether you're working in radio or television, nationally or locally. The local radio and newspaper scene is particularly difficult. Difficult because they are so dependent on advertising, and obviously you will know, you've been broadcasting it every day, the dramatic impact of the virus on local business. And of course, if local business is not generating income, they're not taking advertising. If people are not going out to shop, there's no point in advertising. So that has taken a big toll on local media organisations. And I suppose you also have to acknowledge that sport is a significant part of the local sporting community. Like yourself, I come from a local journalism background, and I know that sport is very important. Local media are important because they bring the local news to readers. So I would argue that while the challenge was never greater, the importance of local radio and local newspapers is never greater. People want to know what's happening in the local community. It's very difficult at the moment because companies are finding it so hard. But I would say that we in the NJ were involved through Congress in lobbying for government aid in relation to specifically for business too, so that they could keep people in employment. Most companies have applied for that, and some of the dark threats last week have been lifted by some, but not all companies.
Yes, because there were layoffs, temporary or otherwise, by different companies, and some employers may well be saying to themselves, why waste a crisis? And they may want to instigate a lot of changes. So the landscape is and has changed dramatically, hasn't it, Seamus?
Well, yes, I think if you look at, one of the large groups is Celtic Media Group, and they had announced significant layoffs. When the government announced their plans, Frank Mulrennan of that company confirmed that they would be applying for state temporary wage subsidy, and that assists a lot of people. It doesn't mean that they will be able to keep on everyone, because if you have dedicated sports journalists but there's no work, it's very hard even for a trade union to say that day off shouldn't happen.
Yes,
and we're in this crisis together. We're all hoping that at the end of it, we will come out and come back serving our communities. In the case of another group, iconic newspapers, which own about 20 titles in Ireland, owned by Malcolm Denmark, who's a London-based businessman, they have decided not to apply to the state aid, and instead are merging a number of titles temporarily, i.e. they're making editors redundant, merging the responsibility, promising to continue the service while at the same time making some people redundant and others laying off long-serving journalists. This happens. So, Tipperary, but they own newspapers in Longford, in Midlands, all over the country. And they haven't responded to representation much less. Really annoyed at the fact that a large player would not contemplate applying for state aid. And what makes that example particularly peculiar is that on the 18th of March, I think, that we actually wrote to all these employees telling them that they had 6 months money and not to worry that there was no stress for their survival.
The phone line is dropping, I'm afraid, Seamus. Listen, we'll come back to you maybe next week or the week after with an update. Thank you very much and keep up the good work, OK?
Thank you, and sorry for any technical problems.
Not at all. That's the way it is at the minute. Appreciate it. Seamus Dooley of the National Union of Journalists, appreciate taking the call this morning. The importance of local journalism, as I say, please, if you're out at all today, or if you're in and you want to get a paper, you can get a paper delivered to you. You can also order some papers online. You can take out a subscription. I know the News and Star are doing it, so please do that. A lot of texts coming in. Jim Griffin has texted in. The over 70s staying in has helped. It's increased our helpline. This is the COVID-19 helpline, and drops threefold. But please encourage everybody to keep doing so. We hear that every day, and please encourage that. Regarding the bus down in Tallow to Dungarvan, some people might need to get to work when they don't have cars. That's why possibly the bus is running. A few people have been texting us in about Bausch and Lomb, that they work there. Can't understand why they're still open. The understanding is that a lot of doctors and nurses would be wearing contact lenses. This is what I have heard, and that they would be deemed essential in that sense. Social distancing is in place in different areas, and it should be encouraged, says these people. Damien, I know it's hard on people. I live in the country in the Lismore area. People coming from town out walking and cycling, exceeding the 2 kilometre zone. People have never travelled these roads before. Please obey the rules and stay at home. A number of people have texted me privately and also on the WhatsApp regarding make sure if you are going out in the evening time, particularly after 8 o'clock, make sure to wear a high-vis jacket. A farmer texted me from Ballymacaw to say he met 3 sets of people out walking last night on the way home from work at around 8:15. Very hard to see people in the dusk as the light is fading. So please, if you're out at all, make sure to wear a high-vis jacket. Stay with us. We are going to be talking about a new book that's just out, particularly dealing with any anxieties you might have.
Mulligan's Pharmacies remind you to keep your distance and wash your hands regularly.
Mulligan's, sponsors of Deise Today on WLR.
Do you have retirement benefits from a previous employment? If so, do you understand them? If you need advice, contact Fitzgerald's Waterford. Our experts will explain your options without the jargon, helping you make the right decision. Fitzgerald Life and Pensions Waterford, providing expert advice right on your doorstep.
Fitzgerald Life and Pensions, The Key, Waterford, regulated by the Central Bank of Ireland.
This is a message from the Rape and Sexual Abuse Centre. Think about it. Just because the person you're with is not saying no, do not assume they're saying yes. Be very clear about consent. Rape is a serious crime. If you've been raped or sexually abused recently or in the past, we can help. You can contact us on free phone 1800 296 296.
Did you know that your gut has up to 1,000 different species of bacteria? Let's keep them happy with Udo's Choice Super 8 Probiotic, the 5-star choice for friendly bacteria from Full of Beans health food stores. Each Udo's Choice Super 8 capsule is packed with an amazing 42 billion friendly bacteria, a party for your pipes. Feel the difference with just one sugar-free Super 8 probiotic capsule a day. Save up to €9 in Full of Beans health food stores, Arkeen Shopping Centre, George's Court Shopping Centre and fullofbeans.ie.
COVID-19 has brought extraordinary challenges to small businesses in every sector. If you, your employees or your business have been affected and you need advice, Local Enterprise Office Waterford is offering free confidential 30-minute consultations with HR, finance and general business mentors. To arrange your telephone or Skype consultation, call 0761 102 905 or visit localenterprise.ie/Waterford. Local Enterprise Office Waterford, helping your business respond to COVID-19.
Mulligan's Pharmacies remind you to keep your distance and at least 2 metres between you and the person beside you.
Mulligan's, sponsors of Deise Today on WLR.
Now, in a second, I'm going to be talking to Brendan Kelly, a professor of psychiatry at Trinity in Dublin. A lot of texts coming in about the issues that we've covered this morning. I have a brother working in Bausch and Lomb. There is not very much social distancing in the locker room, says this person. All the staff need to basically obey it, and they're saying staff should force staff to take holidays. There's a lot of people very angry out here, says this person. Another person saying about the shrinking of content in local papers. That is a very difficult situation, yes, but at the same time they have to produce a paper, and they try to produce a paper, and they've done that. John has phoned in to say Seamus is right. People want to know what's happening in their area. The only way to get it is from local radio and local newspapers. It's really important that everybody gets a paper. Here's a book that is very important this week. Dr. Brendan Kelly, good morning.
Good morning, Damien.
Thank you very much for taking our call. How are you?
I'm fine. How are you?
I'm good, thanks. To produce a book within 3 to 4 weeks is phenomenal, and to have a recommended retail price of 99 cents, so €1 effectively, to get this book. The book is called Coping with the Coronavirus, is it?
Yes. The book, it's an e-book at the moment because nobody's going out, which is as it should be, and it's called Coping with Coronavirus. To be honest, we wanted to make it available for free, but it turns out that the e-book people, you have to charge a little bit. So we're just charging €1, and any royalties will go to charity. It can be downloaded from Amazon or any e-book retailer onto any phone, tablet, laptop, or whatever you might have. These things turns out they're terribly easy to use, which I didn't know myself prior to this, but they are.
Well done and fair play to you. I know you're the author of a number of other books as well. Can I ask you briefly about, we've spoken about ways that people can manage your mental health, anxiety management techniques, and I know you give a lot of indications within the book. Anybody listening this morning, particularly over the age of 70, if they're stuck in the house, we had a caller from somebody who feels like a leper, feels they're being treated unfairly. What would you have to say to them this morning? Because there's not only is there worry there's anger there as well, that if you're over 70, you're being called, this is not right, you're being put into a cohort. Now, the government's doing it to save people, of course, but what would you have to say to those people this morning, Brendan?
Well, I think the two big messages from this is that this is a hugely unusual situation. So we're going to be anxious and terrified and angry and sad. And the second big message is that we do have the resilience and the capacity to get through this. And particularly people over the age of 70 who have seen more of the world than certainly I have. Most of them have the psychological and personal resources to get through this. So I can understand their anger. I get emails from a lot of people over the age of 70, and they're angry in their homes or they're absolutely terrified. But I think the big message is that by staying at home, anybody, particularly those over 70, are making an enormous contribution to their own well-being and to that of everybody else. Ideally, we would all stay at home all the time. So for the people who are at home, particularly older adults, they just need to console themselves to the extent that they are making a far bigger contribution to public health than many people who are going out and about. But this is incredibly difficult, and some of the things I go through in the book are trying to manage this new situation whereby we need to live with a heightened level of anxiety and uncertainty. The risk, how long this will go on, and just how these things end. These are now parts of our life, and we need to live with them rather than fight them as much as we're doing.
Very, very good advice. I know the book is available, as you say, to download. We're going to podcast this interview with a link to the book so people can access it on our website, on Facebook and on Twitter later. One other aspect that's important, Brendan, is when you're dealing with, obviously, psychiatric matters and stress-relating matters, it's important to put a time frame on things. I think that's one of the things that is stressing some people out. The end date is not there. We can't see it. Like I've been advising people to edge through every day. Just take it one day at a time. What would you advise people?
Well, I agree. There are aspects of this that we cannot control, and we need to accept that and control the aspects that we can. For example, one of the things I talk about a great deal in the book is managing our intake of information. So I know people who are checking out the global situation multiple times per day, and this serves no purpose. So what I recommend is spending 15 minutes in the morning and the evening checking in with the global or the national position, but between those times only letting this intrude as much as it does in your day-to-day life. We can't carry the weight of the world around every day. The other aspect of looking at what we can control concerns children who, we need to talk to children about this. They know vastly more than we think they do, and they pick up on the emotional tone. So we need to tell children there is a problem with a new illness, but that we can make a huge difference through simple things. We need to translate the big concept into concrete action and march the children in to wash their hands, just to demonstrate that we do have control over parts of this, because children fear a complete lack of control. And as adults, one of the wonderful and also terrifying things of being a parent is children start to imitate you. And if we can set a good example now with some good diet, some good sleep and some good habits with our phones and our computers, children will really benefit from that and pick up on what we do.
Super advice. Dr. Brendan Kelly, thank you so much, and mind yourself and your family.
Thank you.
Thank you very much, Dr. Brendan Kelly there, as you heard, Professor of Psychiatry at Trinity in Dublin. Royalties from the book will be donated to medical charities assisting with the global response to coronavirus. The book's called Coping with Coronavirus. It's an e-book. It's only 99 cents and you can get it online. We'll podcast the interview later. Another text into WhatsApp. I'm in Bosch and Lom. The company are managing the situation as best they can and they're doing a great job. I'm very, very happy to work here. People need to start copping on and get on with it. You don't hear people from the front line whinging. Other people saying, should people be travelling on buses, local or otherwise? Should they have the same rule applied to them in terms of where they are going? Another texter saying, can two people from different families travel in the same car going to work? It's not been recommended at the present. You're only supposed to stay within your distinct family network, and that has not been recommended at the present. Stay with us. We're going to be talking about men's sheds next. Now, a lot of texts and comments still coming in, 083 3333 975. I'm going to go straight, though, to Barry Sheridan, CEO of the Irish Men's Shed Association. Good morning, Barry.
Morning, Damien. How are you?
I'm good, thanks. How are you keeping?
Very good, very good. Yeah, challenging times for us all, but yeah, holding up okay, I think. So far, so good.
Very good. We're going to get Andrew Power on the line in a second as well, a Waterford volunteer and shed member. Tell me, please, about this Call Them for a Cuppa campaign.
Yeah, well, look, obviously, tricky times for everyone and challenging times for everyone, and unfortunately, temporarily, we have to, in line with all the guidelines, our sheds aren't able to meet at the moment, so we're trying to figure out and get our sheds, who have been fantastic and really resilient through this whole thing, the best way to connect with each other. And one of the number of measures we're doing, so they're doing buddy systems, they're doing WhatsApp groups. But one of the very simple concepts of a shed is sitting down over a cup of tea and having a chat, having that physical conversation with other people around the table. And what we're trying to do under the new campaign, which is called Call Them for a Cuppa, is a very simple idea to shed members, but also to the wider public, is that this morning, around this time when you're sitting down for a cup of tea, just think about picking up the phone and having a conversation. It's fine sending texts, WhatsApp messages are fine, but actually the difference that actually hearing someone's voice, a familiar voice, can do to someone during times like this, especially the more vulnerable people in our community, and after the weekend, people who are now cocooning and self-isolating, etc. The sound of a familiar voice, or even just having a conversation with someone, can really brighten up their day, or even their week in some instances. And we're just encouraging everyone. We're doing it within the sheds movement already. It'd be brilliant, like staying in contact with each other, but we're putting it out there to the wider public. Actually pick up that phone and actually call either family member or neighbour or someone you haven't talked to in a while, and just have a conversation and stay connected the best we can.
Stay on the line, Barry. I think I've got Andrew Power on the line. Are you there, Andrew?
Sure, we are, Damien.
Which shed are you involved with, Andrew?
I'm in the Deise men's shed down in 6 Crossroads Business Park down there. So we've about 30 members, between 30 and 40 members down there at the moment. So a lot of these people will be, I suppose, intrinsic in the shed community in itself, so not having the ability to go back down to the shed like they've been doing for maybe a year and a half, 2 years, is a huge loss, and they feel the effect of it. But as Barry was saying, like the phone calls around, we have a WhatsApp group set up, in fairness to me, like having he drove this on, and there's 30 members there in that group, but that's really an extension of our community, There's great old banter on that, and to be honest with you, there has to be in the morning that I have to woke up and laugh at some of the messages. I know I couldn't share some on daytime radio with kids off school and what have you, but the crack is noisy, and it's just, I think it's just that extension of community, really. That's the core thing, keeping everybody together. And that seems to be kind of washing through, thankfully. So,
it is. Stay there with us, Andrew. Barry, what Andrew was saying there, as you say, the WhatsApp group, and that combination of humour, and if you do need to talk to somebody individually, then for that phone call to have a chat with somebody, because so many people have become dependent on men's sheds over the last couple of years, haven't they?
They really have. Today we've probably got 12,000 men around the country and 12,000 families who are affected by not having sheds open at the moment. So that's a huge strain on them individually and on their family life as well, because it makes such a difference to everyone in that environment, because they said it's such a positive place and they have such positive experiences when they go there. And that, we're asking people to do the exact opposite of what men's sheds was set up to, and that was to break down social isolation, and now we're telling them to isolate. So it's a real challenge, but what we have seen around the country, like what Andrew described there, and Andrew and the guys in Waterford and the other sheds in Waterford, are some brilliant sheds in there. I'm really sure that the resilience that they're showing will come through, which means that when the sheds are back open again, they'll be stronger than ever. They will need support and they will need the community to row in behind them again, but they will be strong, they will be there, and they'll be open for new members to join. And I think sheds are going to be more needed when we come through this than ever before, and I look forward to that day when we can open our doors again and get all members of our community into our shed and share that bit of crack and banter that Andrew was talking about, and that can go a long way to making your day a little bit easier.
Andrew, can I ask you specifically, have some people found it more difficult than others? I presume some people mightn't be texting in on the WhatsApp group, and others you'll think, God, that person hasn't been in touch, I wonder should I give them a ring? Are you finding that?
Not really particularly. There's 30 members in the group, and they're the core members of the shed group. Some members come and go, but there's 30 members there, and everybody, it's almost like for one member that's in the group, if there's somebody that they're not seeing, I suppose, interacting in the group, they'll know that person a little bit more than the next door person. So they'll make the phone call, that kind of way. And we all know people that are not in that group that I suppose we're not seeing them interacting. There's no bother. We pick up the phone and make a call. There's no bother there whatsoever. And I suppose it's knowing that there's people there behind the scenes that will help out, no matter what. And it's just a phone call away, really. Pick up the phone and make a call, and we'll be there. We'll help out. We'll do what we can. That's the spirit of men's sheds, really. There for each other, shoulder to shoulder.
It is really. It's Call Them for a Cuppa campaign. Andrew and Barry, thank you so much for joining us this morning. Really appreciate it, lads, and keep up the great work, okay? Thank you very much there. Thanks, lads. That's Barry Sheridan and Andrew Power. Barry is CEO of the Irish Men's Sheds Association, and Andrew Power, Waterford volunteer and shed member. To anybody involved with the men's sheds, I have the greatest of respect for you, and well done, and keep up the great work. We've done quite a bit on the programme here over the years, and particularly the last year I was out talking to different people at the men's sheds, and they are really marvellous things. So if anybody wants to know more about that, check it out on the Men's Sheds website. The campaign is called Call Them for a Cuppa campaign. Keep your texts and comments coming in 083 3333 975. That's text or WhatsApp. Or you can phone Audrey on 051 846 123. A text in, Damien, I'm a member of the Deise Shed and the crack and banter that goes on is fantastic. Well done, lads. Jimmy Fitzgerald has texted in to warn listeners there's a scam texter on Pust. Tell them not to touch it. Another person texting in about Bausch and Lomb and saying that they are trying their best. Other people saying that not whinging about social media first. You get this in every factory. Some people will whinge, others try to get on with it. Proper chains of command are put in place. A texter in, why are off licences staying open? Another texter saying it's very dangerous walking on some roads. The Dunmore Road, for example, now that the 2 kilometre distance is in force, there's lots of people out walking, but the footpaths are not 2 metres wide. If someone meets a family with a buggy, you have no choice but to go on the main road. Someone could be knocked down. And Marie is saying, please, 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 everybody take care as much as possible. Paul has texted to say, I hope when this is all over the government will invest in capital projects like the North Quays so we don't spiral into another recession. A texter in about bank charges saying AIB taking bank charges out of people's accounts, leaving them with nothing. This shouldn't be done. A texter from Mary in West Waterford saying, I've seen so many people in my local supermarket that are using it for a meeting point to have a chat. They're not moving on. It's not wide enough to get through, so it can cause difficulty. Some people still haven't got it, says this texter. And here's a difficult text. Good morning, Damien. I'm employed by the HSE doing home support. I'm in self-isolation for 14 days. I'm due to go back to work next week. I don't want to go back. My husband has a health issue and I've got small children. I'm in a terrible position. I love my job. I need the money, but I want to protect my family. Again, a very difficult decision there on that. Owen has texted in, will other projects such as the North Quays be put on the long finger because of the matters now? When are we going to hear about those things? And we just don't know. Another texter, would people please get dressed if going to the shop? Oh my God, I've seen a fella wearing PJs and slippers going into the shop. And let's say he needs a wash as well. Text us in. Have you seen anybody going into the shops with the pyjamas on or the dressing gown on? 083 333 975.